We chose really some challenging talks and baseline talks here to start the day with, and one of these is next. And Dr. Nephew, she's a colleague of mine. She's an assistant professor of medicine at Division of GI and Hepatology here at Indiana University with me. She is also the vice chair for health equity here at the School of Medicine as well. And she's really well known for her work in social and structural determinants of health, and that these contribute to the treatment and management differences in patients with chronic liver diseases and even liver cancer. She works to develop interventions that move patients better to health equity. This is a little bit of a new topic for AIH, so we're really pleased that Dr. Nephew decided to help lead a research project this past year, which we're presenting at the liver meeting in the next month. And she's going to share a little bit of that data and highlight some of these issues with you today. So please join me in welcome Dr. Laura Nephew.
Good morning, everyone. I'm really happy to be here to share with you all about this topic. We're going to be talking today about unmet needs in autoimmune hepatitis. Okay, this is our outline for this morning. I'm going to define unmet need, and this may seem like an intuitive definition, but I want to make sure that we're on the same page about the definition of unmet needs from a healthcare standpoint. I'm going to define the social determinants of health. There's going to be a talk later today that talks in a little bit more depth about the social determinants of health, but I want to give a little bit of background about that and the relationship to unmet needs so that we can talk a little bit about the study that we did with the Autoimmune Hepatitis Association. And I'm going to show you some of the data, and thank you so much for all of you who opened up the email and clicked on the link and filled out the survey. So I'm going to show you some of your own data from the survey that you all filled out. So we'll go through some of that data, and then hopefully we can have a conversation about where we go after that data. What are some of the next steps that we need to take to address those unmet needs in the Autoimmune Hepatitis Association? So let's go ahead and get started. So what's the definition of an unmet need from a healthcare standpoint? So an unmet need are the difference between services judged necessary to deal appropriately with health problems and the services actually received. So I'm going to say that again. The differences between the services judged necessary to deal appropriately with health problems and the services actually received. So that gap between what you feel like you need to actually appropriately achieve a good healthcare outcome and what you actually get. Okay, and so there's a gap there, and that gap in health services is called an unmet need. Okay, and so we really need to think about, from a healthcare standpoint, how can we deal with that unmet need so that our patients can really achieve the health outcome that they need. This is a figure that I really like that's taken from a systematic review. A systematic review is when a number of research studies are gathered together and summarized in one place. And this was many studies that were taken from patients from a number of different liver diseases, but there were over 4,000 patients in this study with autoimmune hepatitis. And you can see in the orange boxes that it summarized some of the domains or types of unmet needs that we see in healthcare. And so we see unmet needs in the kind of information space. So we see patients who have unmet needs in healthcare information and in the things that they need to be able to answer questions, to be able to address their healthcare. We see, I'm going to take my glasses off. We see unmet needs in healthcare and the ability to be able to reduce stigmatization around certain types of liver disease. And we also see unmet needs in healthcare providers being able to provide the support needed for people to be able to address their liver disease. And so these are some of the different unmet need domains that you see inside these orange boxes. And then within those kind of color boxes, you see health-related quality of life. And so unmet needs can kind of lead to you having a difficulty being able to address some quality of life issues. So it can lead to difficulty addressing kind of mental health domains, issues addressing disease-related domains, your physical health, fatigue. So these unmet needs can trickle down to multiple different areas related to your disease and your overall life and well-being. And so these unmet needs are important, and they're unfortunately understudied. And so we talk a lot about, how to address the medicines that you take, how to address the types of steroids and all these other things that you take to address your liver disease. But some of these unmet needs are not as addressed, and they're equally important to your healthcare outcome. Unmet needs can impact your family, your social life, your employment, your financial status, and these sequelae can really go unseen by us healthcare providers. And we know that your unmet needs can, as I showed in that last figure, can really go on to impact your health-related quality of life. And there have been a number of studies that have shown that your health-related quality of life can then go on to impact how your disease progresses and how you respond to treatment. So there's kind of this progression, right, that if you have these unmet needs, and these unmet needs impact your health-related quality of life, and then your health-related quality of life impacts how you respond to treatment. And then if you don't respond to treatment well, then your disease progresses, right? So it's really important, right, that we address these unmet needs so that you can have a good quality of life, you have a good response to treatment, and that your disease doesn't progress. So this is not something that we want to ignore because all of these things are related, and they're just as important as whether or not you're responding to prednisone or azathioprine. They're just important to your healthcare outcome. Equally as important, and something I've spent a lot of time studying, are your social determinants of health. So your social determinants of health are the non-medical factors that influence your health. These are your socioeconomic status, where you live, your income, your education, your place of residence, your neighborhood. Do you have green space? Can you get out and walk? Can you exercise? Do you have access to good health care? Do you have insurance? Are you able to see providers? All of these things are important, and you can see in this figure on the right that 50% of your healthcare outcomes are determined by this. It's important that you are able to access good treatments, but a lot of your health outcome is determined by these really important socioeconomic factors. So again, I can't stress enough how important unmet informational needs and unmet needs and your social determinants of health, these things are all important. They all impact your healthcare quality of life, and they all impact how well you respond to treatment and how well you do. And these are domains that unfortunately we haven't focused on a lot as providers, and they're critical, just as critical to how well we treat you and if we pick the right medicine, to how well you respond to therapy and whether or not our treatments are going to achieve the outcome that we hope you receive, that you achieve. Sometimes when we think about the social determinants of health, I think we think, oh, well, these things matter for heart disease, and these things matter for cancer. These things matter for, some other diseases. But there's been a lot of literature that show that these upstream social determinants of health are just as important for liver disease. And this is just a figure that shows that these upstream factors, they trickle down, and they determine liver disease too, okay? So they determine whether you access transplant, they determine whether or not you access hospitalization, whether or not you get access to good treatments for liver cancer and some of the sequelae of liver disease. And so I think sometimes liver disease outcomes aren't thought of as impacted by the social determinants of health. And sometimes we think of these as things that only impact other diseases. But they're just as important to liver disease, and they're just as important to autoimmune hepatitis as well. Uh-oh, we're going backwards. So when we're thinking about health-related quality of life and chronic disease and income, I want to try to pull these concepts together, and this is this one slide. So this is a study that looked at a number of different chronic diseases, and what they showed here was that if you look at the blue bars, that people who had low income, so they looked at people who came from kind of poor social determinant groups, They had a poor experience, so they had worse health-related quality of life across all domains. And I imagine they probably had a lot of unmet healthcare needs. And so if you look at their pain, their mobility, their anxiety, on every kind of experience of health-related quality of life, these people who had poor incomes had a worse experience, okay? We just don't have this data. We don't know. We can't answer this question for patients with, we can't answer this question for patients with autoimmune hepatitis. Honestly, we can't answer this question for patients with liver disease. And so this is what we set out to answer with this study. We wanted to know, one, what were the unmet needs for patients with autoimmune hepatitis, specifically in the Autoimmune Hepatitis Foundation. So what were you guys' unmet healthcare needs? And then two, we wanted to know, was the burden of unmet healthcare needs worse in patients who had low socioeconomic status, who came from groups who had a higher burden of social determinants of health? Because if that is true, if the figure in the Autoimmune Hepatitis Foundation looked like that previous figure, did we need to tailor interventions? Do we need to come up with programs specifically for that group of patients differently? Do we need to think about that group of patients differently? So that picture on the right is one of my mentees who worked really hard on this project, and I just wanted to highlight her here. She came up with a survey that you all took some your time to fill out, and I just want to now show you what you all your data. Oh my goodness. So a survey was emailed to over 3,000 of you all, and it was posted on social media. Many of you saw it from May to June of this year. And it was a 50-item questionnaire, and it was adapted from a lupus questionnaire because we wanted to use a questionnaire that had been validated in another autoimmune disease. And the questionnaire asked questions on several different domains. It asked questions about healthcare-related quality of life, so physical questions about daily living, psychological questions. It asked questions about unmet needs and health services and health information and social support questions, and then it asked those questions about employment and financial questions about the social determinants of health and socioeconomic status. We then wanted to ask them just basic questions about demographics, about liver disease severity, and then where you lived in the world. In order for us to kind of understand that group who had the highest burden of poor social determinants or came from a lower socioeconomic status group, this is how we define that group. Anybody who said they came from an annual household income of less than $30,000 per year, who had a high school education or less, who had Medicaid or who had no insurance at all, who had a high concern for having issues with transportation, who had a high concern for having issues with food, or had a high concern for having issues with housing or difficulty with expenses. This was a group who we said had issues with socioeconomic status, and this was a group that we separated out to explore overall unmet needs and then unmet needs for this particular group as well. So we had 444 folks who responded to the survey. Again, thank you so much for your time. And this is the group kind of separated into two groups. Those who were in a kind of high burden of social determinants of health, or the low SES group on the left. And you can see that the groups were pretty similar. Most people who responded to the survey were women. In our low SES group, there was a slightly higher number of people, 21.6% of people who had cirrhosis. That's been shown previously in the data that if you struggle with finances, that there's often a higher burden of people with more advanced liver disease in that group. There wasn't a lot of diversity, unfortunately, in our survey respondents. 4.3% of our group was Black, and 75.7% of our respondents were from the United States in the low SES group, and 84.8% in the moderate to high SES group. This is kind of a summary of kind of all of the data. There were 6 different domains, as I showed you before, that we looked at. And I think the takeaway message from this table is that overall you all reported a high burden of unmet needs in all domains, okay? So overall, you guys have a lot of unmet needs. So this table on the right, it says moderate to high. This was if you answered yes to at least one question in each domain. So you can see that there was at least, the lowest was 47.7%, and that was in the social support domain. Okay, so we're talking about, you know, if we look at health services. So I was most interested in the last 2 domains because I think those are the unmet needs that we can address from within the healthcare system. So at the health services and the health information domains, it didn't matter which SES group you were in. I consider that a problem, okay? So in the moderate to high SES group, 61.8% of people reported at least a moderate to high unmet need in at least one question. In health services, and 69.3% in health information unmet needs. It was higher in our low SES group, so I think that that's telling us that that group really has a high burden of need, but it was just high all around, okay? And I highlighted those 2 groups because I think, you know, those are things that we can address within the health, from within the healthcare system by partnering with groups like the AIHA, with partnering with patients to better understand what it is that you need. We can do something about that. To delve a little bit more specifically into some of the things that were really problematic, you can look at questions 1, 2, 3, and 4 on the left. So number 1, having healthcare staff acknowledge and show sensitivity to your feelings and emotional health. Being taken seriously by medical providers when expressing concerns about health problems, getting adequate information about side effects of treatment, and having an opportunity to talk with someone who understands and has similar experiences. If you look at the figure on the right, the blue says that you had no concern, okay? So you can see that there's not a lot of blue and there's a lot of red and yellow, okay? So the yellow says that there was low need, red says there was moderate to high need. And so just overall, there was a higher amount of need in our low SES group, but overall, I would just note that there is a pretty high amount of need overall, but significantly more need in our low SES group. And I think that these are the types of unmet needs that could really be addressed. These are things that we can do better in. We did a multivariable model, not to delve too much into statistics, but a multivariable model just says that if you control for other things, all things being equal, if you want to say, well, maybe the reason that the low SES group is experiencing these things is because the race is different or the gender is different. If you control for all these other things, you will still see that those in the low SES group still experience a higher burden of unmet needs in the health service domain. And so that's all of this is showing that the low SES group still had a 2-time higher unmet need in the health service domain questions. And this was one specific question about having the opportunity to talk with someone who understands and who has similar experiences to them. So conclusions, there's a high burden of unmet need in all domains in patients with AIH. And there is, the need is highest amongst people with low SES. And this seems to be independent of demographic and clinical factors in our multivariable modeling. And so what do we do about this? I think we need to do some qualitative work, and that simply means we need to sit down in small groups and talk to people about what we can do better. And we need to specifically talk to people who are in those low socioeconomic status groups to understand what we can do better. We need to recruit from sites that have higher amounts of diversity so that we can understand some of the groups that we're missing from this study. And that's something that's really important to me as someone who studies health equity. And then we need to work with what we already have. So we need to improve provider education around some of the existing resources that groups like this already have. How can we disseminate some of the things that we already have to meet some of the needs that patients have? And then I'm excited to hear about some of the ideas that you all have about how we can better meet some of these unmet needs that you all identified on the survey. Thank you.
So if there's any questions for Dr. Nephew, we thought we may just use this last 5 minutes to also think from a patient perspective of other things that maybe didn't come up on the survey or patient ideas that are directed at these unmet social needs as well. Did any of those points resonate at all with anyone in the room? I think some of the things that I'm embarrassed about is about the health services component. Again, thinking that we can always do better. If you want to think about health services a little bit more in detail as well, what at your doctor's office is the problem? Is it the information? Is it the unwillingness to talk about symptoms? Is it different types of information that are provided by different providers? Is it stigmatization from allied healthcare staff? Just to get you thinking.
I'm just curious from a average Joe perspective, like, is there anything we can do to help with this situation or shed light on it?
Well, I think we want to understand what information it is that we can better provide. So I think we want to hear from patients, what is it, when you go to an office, what is it that you feel like you aren't getting? And what way would you like to receive it? You know, is it in a video? Is it in a brochure? So I think we want to hear from you.
Do we have any information on how these numbers compare to?
I hear you, I don't see you. Can you wave your hand? Okay, thank you.
Do we have any information on how these numbers compare to healthcare in general? Someone just going into a doctor's office for a checkup or for a flu or for whatever. Is it really this liver-related disease that we're talking about that has these unmet needs, or is it generally speaking that there are unmet needs across the entire healthcare spectrum, and how much of a gap is there between those two?
That's an excellent question. I can tell you, because this is a validated survey tool that has been administered in lupus, our unmet needs are a bit higher than they were in lupus. And I suspect it's because our disease is a bit rarer than lupus, and there may be a bit less information, and providers may have a little bit less information to provide patients than providers may have about lupus. Because of the time constraints, I was debating whether or not to compare what is known already about this tool to lupus, but I would say our numbers were a little bit worse. Mm-hmm.
Okay, kind of going off of that, you mentioned that since this disease is more rare and there's less information, something that's important to me is, like, my doctor's very honest with me, gives it to me straight. Like, we don't know that much, and for me that's super important, like being honest, saying, yes, I'm a doctor, but honestly we don't know that much about it, and be willing to talk to the patient like that. And I don't know if this is a problem with, like, people in the study, but for me, I feel like time is super important. Like, getting a full hour with my doctor and, like, having 30 minutes to just ask the random questions that I feel very confused about. And I don't know if that's something that's not happening at other places.
Do you have a 30-minute appointment or hour appointment?
I get 1 hour Zoom calls with my doctor.
That is not happening in many places.
Yeah. I mean, to be fair, I'm still with my pediatric doctor, but still, I get 1 hour Zoom calls like every 2 months.
I know. I mean, and I can tell you just that time with patients is important because a lot of times it just takes some time to work up to your questions. It just, I mean, with your provider, it just takes some time. So,
Yeah, exactly.
so time. Okay, we're listening. I'm listening. Time. Okay.
For me, it was before I was diagnosed, it took a year, and none of the doctors listened to me. I was told it was I was obese and constipated. That's why I wasn't feeling good. It wasn't until my eyes turned yellow that I got took me seriously and started testing me for other things. And then it wasn't until I was someone saw my blood work and one of the doctors from Kaiser in LA, hepatologist, told me I needed to get admitted and go right away. That he took it seriously. And I actually ran a bunch of tests that I was finally diagnosed. And then my current hepatologist now, he is amazing. But I also feel like sometimes he doesn't take what I'm feeling seriously. So I just feel like that's also an unmet need that is going on. I am my own advocate, and I feel like I have to do my own research. So like different drugs that come up that I'm researching, I feel like I like bring to his attention. So I kind of feel like maybe that's something he should also be doing. But I also know his doctor is not a superhero, you know, succeeding everything. But yeah, I just feel like just listening to the patient and hearing them out and their concerns, not just brushing them off. You know, because what I'm feeling is what I'm feeling, and to feel validated and not just like, okay, you know, whatever. There's just brushes them off.
Yeah, that's a common concern is how can we have better patient-doctor communication where we validate what patients are saying and hear them, actually hear them, listen to what they're saying and respond to what they're saying. And then how can we empower patients? How can a society empower patients to have the information so that they can give that back to their doctor? So you had medicines, you were ready and empowered to show him medicine. So maybe that's something we can help provide for patients, kind of give them the weapons to kind of go in and say, these are the kind of the cutting edge, you know.
It was important for me, so that's why I was like, well, what about me? What else?
Yeah.
What can we do? You know, so what else?
Patient-doctor communication and cutting-edge information so that you can be your own advocate. Okay.
Hi. So I think for me, going back to, I'm echoing the similar sentiments that's been said so far. When I got diagnosed 2 years ago, I never heard of AIH, and I literally had to be my own advocate. What was helpful, though, is my hepatologist is very accessible. I have his cell phone number. I know that's a luxury that not many people have, but that has been very helpful because he's also very candid and saying, you know, there's so much out there that we don't know, and so we go back and forth. So that's helpful, having access to the doctors. I also saw in the packet here that I got some brochures to disseminate, so I think that's important too, because everything I've found out about AIH, I've actually found out on my own. So being our own advocate is essential, and having access. So, yeah, and I'm not in a low SES.
Yeah,
so
we've talked
that's
about that
even,
before too.
you know, I mean, I'm you know,
Yeah.
full disclosure, I'm a psychotherapist, so I know how to advocate for myself, and it has been a fight.
Yeah.
An extremely difficult fight. So.
Well, I'm
Yeah.
looking forward to participating in some focus groups with the AIHA. I think Dr. Lambert will be talking more about that in the future to kind of help address these unmet needs. So thank you so much for your time.